You're listening to the Sex and Psychology Podcast, the sex ed you never got in school and won't get anywhere else. I am your host, Dr. Justin Lehmiller. I am a social psychologist and research fellow at the Kinsey Institute and author of the book, Tell Me What You Want, The Science of Sexual Desire and How It Can Help You Improve Your Sex Life. More cosmetic surgeries are performed on the chest than almost any other part of the body, with breast augmentation being the most common. Not too long ago, bigger is better seemed to define the ideal when it came to implants, but recently we've seen a shift towards smaller, more natural-looking results. So what's behind that change? Are we actually moving toward a different body ideal? In today's episode, we're diving into the world of chest surgery. We'll explore trends in breast implants and what they reveal about shifting beauty standards. We'll also look at how this is a field largely dominated by men and what that might mean for how the ideal breast is shaped and constructed. At the same time, we'll broaden the conversation beyond augmentation to include procedures like breast reconstruction and breast reduction and the very different psychological meanings that people attach to them. I am joined once again by Sarah Thornton, a sociologist, nonfiction writer, and author of 4 critically acclaimed books. Thornton's most widely read book is 7 Days in the Art World, which is translated into over 20 languages. Her latest is titled Tits Up, The Top Half of Women's Liberation, which explores the significance of breasts across radically different social worlds, including a strip club, a human milk bank, a plastic surgeon's operating room, a bra design studio, and a feminist spiritual retreat. This is going to be another fascinating conversation. Stick around and we're going to jump in right after the break. If you love the science of sex as much as I do, consider becoming a friend of the Kinsey Institute at Indiana University. The Kinsey Institute is the world's premier research organization on sex and relationships, and you can help them continue the legacy of Dr. Alfred Kinsey, whose pioneering research changed everything we think we know about sex. Visit kinseyinstitute.org to make an impact. Your donations can help support ongoing research projects on critical topics. You can also show your support by following Kinsey Institute on Facebook, Twitter, and Instagram. Thank you for supporting sex science. Okay, Sarah, in the previous episode, we talked all about how breasts became sexualized over time. Today, we're taking a look at the world of breast and chest surgeries. So let's start broadly. How common are breast surgeries and how have trends changed over time?
So 90% of plastic surgeries are performed on women. And a good 40% of those surgeries, depending on the country, are on the chest. And sometimes way higher than that. So the chest is the most operated upon part of the body worldwide in almost everywhere, except for a few places like Japan, where they really favor the eyelid lift. And that's true of men and women, because although men do not have plastic surgery as often as women, one of the most common plastic surgeries is called gynecomastia. And it is removal of the man boobs. It is removal of excess glandular tissue in the male chest because we all know there's few things more shameful than a man having tits. So, excuse my crassness. I just found that to be so fascinating. I mean, augmentation is still neck and neck with many other kinds of breast surgery, but the number of augmentations in America has plateaued since about 2008. And we have seen the rise of everything else. So reductions, lifts, breast lifts are very popular because in a way, there's a lot more acceptance of diversity around size. But the one thing that's considered super ugly is sag. It's associated with aging and overweightness, skin laxity. And so saggy boobs, you can have people eroticizing or people admiring for their beauty, small breasts and big breasts. But saggy breasts is a real minority audience.
Well, yeah. So it sounds like breast and chest surgeries are about so much more than just the traditional implants that people might think of, right? And lots of people, regardless of gender, and they can also be cisgender or transgender, are having surgeries, procedures performed on the chest area. So that is one of the most popular areas for plastic surgeries these days. Now, it is interesting how trends in terms of some of these surgeries have evolved and changed, right? So I'm someone who grew up in the Baywatch era, when Pamela Anderson became this cultural sensation, in part due to the size of her chest. And at the time, like in the 90s. And so it seemed like there was this cultural trend toward bigger is better with respect to implants specifically. However, we seem to be in an era now where there's been this shift from those very large, very noticeable implants to something that people are now calling quote unquote natural or even yoga boobs is one of the terms that I've heard. So what's driving that change? Why are we shifting away from bigger is better when it comes to augmentation?
Well, I think that athleticism has become a key way of thinking about beauty. And large breasts are not athletic. They get in the way. They actually decrease your pectoral strength because the implants go under the pecs, so they get stretched out. They can also cause back problems and various aches and pains and discomforts. But yes, the biggest is best, I think, has gone by the wayside. When you see it, someone like Lauren Sanchez, Jeff Bezos's wife, has Baywatch breasts. She clearly admired Pam Anderson back in the late 90s and has adopted that look. But her appearance is kind of retro. Mm-hmm. It's also a little déclassé. So it's really interesting to see this billionaire's wife with a rack that doesn't seem to belong to her status. I kind of admire her for adopting a retro look. I'm all for the gal who parts company with the cliques, but implants are the gift that keeps on giving to the plastic surgery business because they're only warranted for 10 years and often they fail before that. What happened to me, because I had breast reconstruction, I had a mastectomy due to ductal carcinoma in situ. I was really lucky. I didn't have cancer. I didn't have to have radiation and chemo. I feel like I dodged a bullet. I'd been monitored for 7 years. They kept changing, and I think they just got them out in time. But I did have reconstruction, which is controversial in its own sense, actually. I had kind of certain feminist friends saying, why didn't it go flat? I mean, that's the brave and admirable thing to do. And I was like, it didn't feel right to me, So the first time I had the reconstruction, I asked literally for lesbian yoga boobs. And I clarified with between an A and a B cup because B cup was my normal size, except when I was pregnant or breastfeeding. And unfortunately, when I was first measured for a bra post-surgery, I was a D. And this is not uncommon amongst older male plastic surgeons. A lot of the protocols were developed around augmentation. And so they often augmented at the same time as reconstructing. Mm. But what happened to me is after 5 years, only 5 years, one of the implants ruptured. So it was like all this messy silicone wandering around. And the other one, it had flipped backwards. So it's a hemisphere, it's a half circle, and the flat side was out. And so I had them redone by a younger woman plastic surgeon who just gave me the B cup that I was used to. It wasn't even really about what looked best. I just wanted to wear the clothes I'd always worn and be myself. And I think that's the goal for a lot of women. They don't want to look like a cancer survivor. They don't want to look trans, let's say, if they don't identify that way, which was partly my case, being in the gay community. And in the end, I sold off a pile of jackets, which I really regret because I couldn't fit into them. I mean, there's a lot of judgment around plastic surgery and women's chests. I think the whole history of feminism has been very negative and anti-plastic surgery. And I understand those points of view, except that I am now resolutely pro-choice when it comes to anything above the waist, because I feel like women are subject to far too much judgment. If you want to go free the nipple, if you want to show your cleavage, if you want to go big or small or not at all, I really believe that we should try very hard to just honor other women's choices. And I know that's hard because often we have visceral reactions. It's almost like the taste of pistachio ice cream versus chocolate or vanilla. Like you're going to like one and maybe find the other kind of icky. And so we tend to have these visceral reactions around bodies. And I believe in trying to restrain oneself, and even if you feel a little visceral inkling in one direction, bite your lip. Because nobody needs to hear this form of bigotry around bodies. And let's not, yuck other people's yum, as they say. And I feel like women in America are subject to so much harsh judgment. And it's brutal as a teenager, it's brutal as you age. Women spend a fortune on their appearance. They could be getting PhDs, but they're getting a facelift instead. And if that works for them, that's great. But let's kind of let it go a little bit. That's my rational perspective.
Yeah.
That is the place I came to as the only one I could justify, the only one that felt fair and fostered women's liberation. Mm-hmm. Because at the end of the day, I am interested in female empowerment and women's liberation, and women need to get on board for the whole shebang. And that may mean we have to just accept progress comes in many different forms. Mm-hmm. I would say to my students, you're on the Mexican border and you want to get to the Canadian border. Do we all have to take the same freeway? No. There are so many ways to get from the Mexican border to the Canadian border. There are scenic routes. There are beautiful routes, there are fast routes, whatever.
Yeah. So I'm totally on board with you in terms of not judging other people for their choices and not judging and shaming people for their bodies and their appearance. But we know the unfortunate reality is that does happen in our society, and it happens a lot. And, with women specifically in terms of plastic surgeries, there's a damned if you do, damned if you don't kind of thing, where you can be judged for not having a procedure done and you can be judged for having it. And it's just oftentimes for women, it feels like a no-win situation. But going back to the idea we were talking about earlier about bigger is better, something else I wanted to bring up here, because I've gotten a ton of media requests about this in the last few weeks, is this concept of bimbofication, which was a new one to me. It's come up in the news for a lot of reasons, and it led me to do some research down this path to sort of figure out, what's going on here. And it turns out there are a lot of people who are interested in this idea of becoming a quote unquote bimbo. And for them, that involves sometimes physically modifying their body, often to have these extra large breasts. And there's this whole bimbofication subreddit with like hundreds of thousands of users. And most of them are women who are trying to transform physically into, again, a quote unquote bimbo, often through having those very large breasts and other types of procedures. And, it's an interesting phenomenon or trend to look at in terms of other people's reactions to it, because you're going to have some people who look at that and say, well, that's somebody's choice, or they will look at it and say, well, that's actually hot or attractive. And then you'll have others who will look at it and say, why would you want to do that? Because they associate, this idea of being a bimbo with being dumb and so forth. And so it's interesting. I don't know. What are your thoughts on bimbofication?
It's interesting because you don't see much of it in San Francisco because we're a highly educated town. But I do notice it in the facialist places, and the laser places and things like that. And it's more than just the big boobs. It's a very large enhanced
big lips.
It's so much Botox that it's hard to make facial expressions. It skews towards blonde and a preponderance of pink. So like pink lips, pink nails, that whole look. It's interesting. It's very Barbie. Mm-hmm. It probably gets more media attention than the actual population involved.
Oh, sure.
It's very much a niche, I would say. And it's probably a niche that's runs contra to the larger mainstream trend, which is, women are more highly educated than men nowadays. Women are better employed than men nowadays. We don't get the same salaries, partly because, there are still a load of male-dominated jobs that are more lucrative. But I see the bimbofication as a kind of counter trend.
Mhm.
to the larger swathe. We also have the equivalent amongst men.
Looks maxing. Yep.
That seems to be more of a new phenomenon in a way that, so in tandem with this
Bimbofication.
bimbofication, where there's like so much going on with women's appearances in a certain direction, you have a similar thing where looks maxing is creating male bimbos.
Or himbos, as I've heard some call them.
Oh yeah, don't you love that word? So the degree to which intelligence is linked to certain body types fascinates me, because there's a certain brain versus brawn assumption, whereas of course you can have a very brainy, brawny person. The joke in San Francisco is that the gay tech mafia meets at Barry's boot camp, which is very, very brawny. But these dudes all have PhDs in artificial intelligence. So, looks like Tarzan, talks like Einstein. That happens too. But there is also a phenomenon of looks like Tarzan, talks like Jane from the Valley. That's also a thing, which I find fun and amusing. So look, we live in a plural culture, and I'm all for the plurality of it all. I resist it when it becomes a form of normativity and a form of shaming. I get an odd amount of flack for the fact that I don't dye my hair. I'm not very gray, but I'm gray enough. And a lot of women would get rid of it. And I would rather spend my money in other ways. I don't have time. And I also feel like men my age don't dye their hair. The vast majority of men my age do not dye their hair, and they have a little gray, and it's supposed to make them look, sexy. Distinguished, or, they're a silver fox. I'm just going to lean into it for now. I'd rather buy a new pair of shoes.
And again, everybody's free to make their own choices, and we shouldn't judge them for it.
Exactly.
So I want to go back to something that you mentioned earlier, which is how, the world of plastic surgery, in the world of breast implants and augmentations specifically, that has been this very male-dominated field historically and even today. And so I was just wondering if you could talk a little bit about what are the implications of that? The fact that men are the ones who are sort of designing the quote unquote ideal breasts. Like how is male influence in that field shaping the types of procedures that are being performed?
Plastic surgery is incredibly male-dominated. There are other surgery fields which are perhaps even more male-dominated, like orthopedic surgeries. Plastics has a few more women, but it is also very white, and that can impact surgical norms and almost etiquettes. One of my interviewees in Treasured Chess, which is chapter 3, which is a chapter in which I am in the operating room watching many, many different procedures. One of my plastic surgeons is a Black woman based in Washington, D.C., whose specialty is an upper body lift. So she focuses on patients who've had bariatric surgeries, who've lost 300 pounds. And then what happens to your nipples? Where are they? Are they down at your hips? So she reconstructs the whole torso. And what she often finds is that her female patients want implants at that point, partly because they've had, let's say, a very heavy bosom along with a heavy belly. And what they'd really like now is just a full bosom. And what often happens after such great weight loss is there's just nothing left up there. And the size of those breasts might be larger than the white ideal, or smaller, or slightly differently slung. And this is one of her sensitivities and something that she tries to do really well for her patients. I think all the female plastic surgeons I talked to were reticent to assume that their ideal of beauty was the same ideal as their patient. Whereas I feel like some of the men I talked to and a lot of the men I heard about through women patients was that the men did assume that their ideal of human beauty was somehow superior. It was educated. It was enlightened. And, their idea of a perfect C cup was what every woman should have. I think the women kind of knew that wasn't true. One of the main plastic surgeons in this chapter is Dr. Carolyn Chang, who's Asian American, and really a very small A cup, and never thought of having surgery. But she loves giving women what they want, which is often a little bit smaller than what the men had imagined, especially in the past. That is changing amongst the young surgeons. A lot of the male surgeons who are now like 60, they grew up with those Pam Anderson ideals, and it's very hard to get out of your head. Even if they think they're listening, they may not really be listening and hearing what a woman wants from her chest. One of the most amazing surgeons amongst the group featured in Chapter 3 is Dr. Potter, based in Austin, Texas, who principally does reconstructive surgery after cancer. And her specialty is to create breasts from belly fat that is living organic tissue. So you don't use an implant, and you move that belly fat up to the chest. It's a microsurgery. It involves very difficult vascular surgery, but it means you have a living chest that is warm with a heartbeat, unlike the silicone implants that most of us get. And that's a pretty miraculous thing to watch. Actually, I watched quite a few of her surgeries. She does it in tandem with a hand surgeon who does a lot of the vascular work, stitching together the capillaries. It's amazing when you hear a heartbeat, when you can hear the blood flow through a newly constructed breast. And the virtue of that is manifold. One, it's a surgery one and done. You get implants, you got to replace them. That's why they're one of the most lucrative things for the plastic surgery business. Whenever there's like some object to buy as part of the surgery, it just augments the overall price. Also, implants don't like to be radiated. Women who've had chemo sometimes have skin issues. There's a lot of reasons to go with that surgery, although it is longer and the recovery time's longer. And most plastic surgeons don't perform it. It is very specialist surgery, but it can be a miracle for a woman who's, been through absolute hell, had her 6 months of chemo and then had to have some radiation, God forbid. And that kind of reconstruction, and also get a little mommy makeover, as they call them, get rid of a little belly. It can be a great way to reunite her with her body again.
It's so interesting. So there are so many different procedures that are available, and there may be differences in what different doctors are willing to perform. It might also differ based on their gender, but it can also differ based on culture too, right? The idea of, what the ideal chest or body looks like varies pretty substantially from one culture to the next.
Well, in America, it is remarkable that women have so few federal rights, but we have the right to fake tits. And that is because we have the right. Women have the right, if they have insurance, to reconstruction. The insurance must cover breast reconstruction. This is quite something. There's no right to breastfeed. There's no right to a lot of things for women on a federal level. But back in 1998, the Women's Cancer Act enshrined in law that we had the right to implants. And that is most peculiar and not universal. This is not something you find in all countries. In Europe in general, depending, those national health services will cover reconstruction in many circumstances, partly because it is perceived as an important psychological thing for some women, often younger women. But it is remarkable that in America, women do have the right to fake boobs.
Who knew?
I'm a bemused beneficiary of that. I'm glad, but I don't know if I could choose between the right not to become pregnant if I didn't want to, the right not to be pregnant if I was raped, that kind of freedom of choice versus the freedom to have breast implants, I think I'd have to choose the former as the more significant right. But, men rule the world. Straight men.
Well, Sarah, this has been absolutely fascinating. And for folks who want to learn more about this, they can check out your fantastic book. So thank you again so much for your time. I really appreciate having you here. Can you please tell my listeners where they can go to learn more about you and your work and get a copy of your book, Tits Up?
So the book is called Tits Up, The Top Half of Women's Liberation. You can buy it online almost anywhere, books.org, Amazon, Barnes & Noble, if they're still around. I hope so. And your local bookstore, if they don't have it, they can order it. It's pretty easy. It's in print. I have a website that I update rarely. I'll be speaking in Toronto in a couple of weeks on April 22nd at University of Toronto, if that's anyone's in the vicinity. Please feel free to get in touch with me through my website, which is www.sarah-thornton.com. Also, if I may say, is a very good listen. People love the audiobook. Great for a long drive with the whole family.
Well, great. I'll be sure to include links to all of that in the show notes. Thank you again for your time. I really appreciate having you here.
Thank you, Justin.
Thank you for listening. To keep up with new episodes of this podcast, visit my website, Sex and Psychology, at sexandpsychology.com, or subscribe on your favorite platform, where I hope you'll take a moment to rate and review the show. If you listen on Apple Podcasts, please consider becoming a Sex and Psychology Premium subscriber to enjoy ad-free listening for just $3.99 a month. You can also follow me on social media for daily sex research updates. I'm on Blue Sky and X at Justin Lehmiller and Instagram at Justin J. Lehmiller. Also, be sure to check out my book, Tell Me What You Want. Thanks again for listening. Until next time.